Hello, mental health therapist Suzanne Connors Zink with Dawn Visions Hypnosis. I have a kind of tricky question to ask. Are you self medicating? And that includes alcohol abuse. Because if you are not a happy person. And perhaps it is your patients who are driving you to drink. Maybe because you're finding it all overwhelming. Maybe because you're not getting supervised well. Maybe because you didn't realize all that was going to be involved when you decided to become a mental health therapist. These are all issues that came up when I was doing the research to find out what subjects were important to those of you who are practicing mental health therapy in the conventional sense. And you know that it's rather difficult to provide decent services if you are not able to take good care of yourself. If you are drinking enough to basically be hungover in the morning, that's a problem. That's a really big problem. And the other thing that you need to understand is that, at least from the patients that I work with who had some pretty serious mental health issues, I was working in a social club program for mentally ill adults back in the early 90s. And frankly, my clients knew when the counselors were not in integrity. They knew when they were being lied to, and they knew when the counselors were not capable of doing the work and when they were out drinking all night and when they weren't acting appropriately outside of the job. These are really insightful people. So if this is a problem that you're having, you best address it. Because you don't want to be a person who ends up drinking more and more and become addicted to alcohol, become an alcoholic. It's a pretty terrible thing to have happen to anybody. It's really hard for alcoholics to stop drinking. I know in my hypnosis practice, I've had a horrible time trying to help alcoholics stop drinking. I've stopped taking them on for that very reason. I think it has something to do with the fact that the alcohol goes through the blood-brain barrier, although I don't have any proof of that. That's my hypothesis because I'm able to help people get off of heroin and all other kinds of drugs like cocaine. But alcohol is a whole different problem. And if you are using substances, any other substances, and abusing them, best you get the treatment before it does become a really huge problem in so many ways. And hopefully, when you get that treatment, you'll figure out why it is that you're abusing them in the first place. Because it may not have to do with your job. Who the hell knows? Maybe it's something to do with your personal life. But in any case, do yourself a favor and the people who you are working with a favor and get the help that you need. Because you don't want your life to go that way. I know that over the years I've helped 3 nurses. One was a psychiatric nurse, the other 2 were just nurses who got into pain control meds of their patients. And one of them ended up in jail, unfortunately. And the other 2 lost their licenses also. Obviously, the one who went to jail lost her license as well. It's not a pretty picture. So do get yourself the help that you require. I don't really work with people who have drug addiction, substance abuse issues anymore. But you can go online and find someone who can help you with that. If you want to have a hypnotist, neurolinguistic programming person do that with you and for you. And I think that's all I have for you for this one. I just wish you the best, that you get yourself together if you find yourself in this situation, because it's not a good situation for anyone involved. That's what I know from working with people who have these problems, regardless of their occupation. As always, I thank you for spending your time with me. Till next time. Bye-bye, all.